Hello. Hello. Welcome to Returning to Running Postnatal. My name is Linda Kuesler. I'm a physical therapist at Physical Rockville. And today we're just going to talk a little bit about return to running after having a baby. I'd like to welcome you all. Up until recently, there were no published guidelines on about how to return to running postpartum or when people should return to running. There were 3 professionals in the UK who reviewed all the literature and published a paper in 2019 kind of going over the guidelines to return to running. So we're going to talk about that today. That guideline, that paper is open to the public, available to the public to see. It's called Returning to Running Postnatal, Guidelines for Medical, Health, and Fitness Professionals Managing this Population. The authors are Tom Goom, Grianne Donnelly, and Emma Brockwell. So basically today I'm just going to review some of their findings and their recommendations. As I said, up until that time, there are no national or international guidelines with standardized practice on a framework on a return to running. So they came up with some recommendations and some guidelines on that postpartum. Okay. So their first evidence-based recommendation, and they looked at evidence, all levels of evidence, from case studies and recommendations to randomized controlled studies, and based on reviewing this evidence, they felt postnatal women can benefit from individual assessment and guided pelvic floor rehabilitation for the prevention and management of organ prolapse and management of urinary incontinence and sexual dysfunction. So basically the recommendation is that all women can benefit from a physical therapy assessment of their pelvic floor function postnatal. Their second recommendation is return to running is not advisable prior to 12 weeks postpartum. And for many people, it is beyond that if they have symptoms of pelvic floor dysfunction prior to or during an attempt to return to running. So basically, this is a little bit different than what the common thoughts are. A lot of people feel, like 6 weeks postpartum, I've been cleared by my doctor, and they go back to their activities. This group feels the evidence is supporting waiting for 12 weeks before you start to return to running, and that is that is kind of the beginning point. For some women, it would be longer than 12 weeks. It may be 6 to 9 months, depending on their pelvic floor functions and the symptoms that they're having. So what are some symptoms of pelvic floor or abdominal wall dysfunction? So if you've heard me speak in the past, sometimes I will talk about a canister. When we think of your core, we think of your diaphragm, where my lungs are above my diaphragm. My diaphragm is a muscular sheet that kind of drops down as I breathe in and comes up as I breathe out. But if I think of my core as a canister, the diaphragm's the top, the pelvic floor is the bottom, my abdominals are in the front, and my back muscles are in the back. And my core functions to transfer forces through that system and absorb forces through that system so they don't go all in one direction. Okay? So a lot of these recommendations are to protect the pelvic floor so that a person doesn't have all those forces going down on a pelvic floor that's been weakened postpartum due to the trauma of having a baby or the experience of having a baby. So signs and symptoms of pelvic floor dysfunction include urinary or fecal incontinence, urgency that is difficult to defer, so people who can't make it quite to the bathroom, heaviness, pressure, bulging, and that pelvic floor area. If you feel like things are falling out or it just feels heavy and uncomfortable pulling. Pelvic floor pain with sexual activity. Difficulty with defecation, such as like constipation issues. And a pendulum, like a pendular abdomen, separated abdominal muscles, as well as back pain. So these are some signs and symptoms of dysfunction, okay? And those are things that need to be addressed prior to return to running. There are also some risk factors leading and potential issues with return to running, okay? So a risk factor would be returning too early prior to the 3 months. People with hypermobility conditions, they may be more at risk. So things like Ehlers-Danlos, that may be more of an issue. All right. Okay. Also considering if somebody is breastfeeding because you want support in the sportswear that you're wearing to support increased breast tissue. Pre-existing pelvic floor dysfunction or back pain may be also an issue. Weight, a person's weight is a consideration. People that are larger in weight or obesity are going to have more weight that they have to manage, and so that may be an issue to consider. Even C-sections. Following C-section, consideration should be given to the remodeling of the scar tissue and the strength of the scar tissue. There's a study that showed, I'm going to read that, but uterine scar thickness was still increased at 6 weeks postnatal, suggesting that the process of remodeling extends beyond the traditional 6-week period. That abdominal fascia has also regained 50 to basically 59% of its original strength at 6 weeks. So having a C-section, that area still may be compromised. Also, consideration with return to running is the amount of calories somebody's taking in and the amount they're burning with running, especially if they're breastfeeding as well. So you want to make sure that you have enough calories to accommodate the calories burned with running. Okay. If you begin to run and you start to have symptoms such as like heaviness or, in that pelvic floor area, incontinence issues, a feeling of like decreased strength or separation in that abdomen, back pain, or increased blood loss, those are all reasons just to see a professional. Okay. And a physical therapist can help to assess pelvic floor and abdominal wall function. All right. So once you've gone past your 3 months, what are some things to consider about going back to running? All right. One is load impact in management. So if somebody's assessing, if a physical therapist is assessing a client, are they ready to go back to running? One of the things is, what is their load impact? Can their core, can their body take an impact without giving way, without their pelvic floor giving way? So if you are seeing a physical therapist, there are ways that they can assess what your load transfer is and how your pelvic floor functions with that load transfer, right? Some of the things that the paper did recommend to assess would be that you were able to walk 30 minutes without any pelvic floor symptoms of pain, feeling of dragging, heaviness in the pelvic floor, or incontinence. Single leg balance for 10 seconds. Again, to be able to do 10 seconds of single leg balance without leaking or any pelvic floor symptoms or back pain. A single leg squat, 10 repetitions each side, and jogging in one position on the spot. Forward bounds, hopping in place, and a running man activity. That's when somebody's on one leg and their arm goes forward and the leg goes back, and it's like they're standing. So these are all kind of load transfer or kind of a little bit bounding activity to see, can you do that without any symptoms? So that's kind of one assessment, looking at that load transfer through the core, through the pelvis. Are those muscles functioning and working in the way they're supposed to? Again, as far as how your pelvic floor is functioning, that can be assessed by a physical therapist who can assess how those muscles respond with load transfer activities. Okay. Another thing they recommended was overall strength testing. In order to return to running, a person should have decent strength so they can withstand that activity. This is overall lower extremity strength. The recommendations they had to testing were 20 repetitions of each test, including single calf raises or going up on your toes, single leg bridging, single leg sit to stand, which I find hard, and side lying hip abduction, because your hip strength helps to stabilize your pelvis. Weaknesses in those areas with the strength testing does not mean you cannot run. It just shows which areas you may need to focus on for strength testing, with running. Okay. So if a person is more than 3 months postpartum and they pass strength testing, they can load transfer well, they have no pelvic floor symptoms, how do you return to running? The recommendations are a gradual progression for someone who's, almost like you would go from a couch potato to running kind of program. But you would start with a combination of a walk and jog. So you're not going to just immediately start running miles, but you would start with a walking and then go walk, jog, and then progressing with a jogging program. It is recommended not to increase more than 10% in your running per week. So if you look at the total, like running distance and time should not be increased more than 10%. But if you're starting really low, for example, if you're only jogging 1 minute and you increase to 2 minutes, that is probably okay. It's an increase in time, but there's not a lot of stress or pressure with that amount of increase. But if you're doing longer intervals of running and distance and time, then you're looking at a 10% increase is kind of to be a guide. So hopefully some of those guidelines were helpful. Also, running with a stroller requires a little more energy than running without a stroller, so that's a little bit of a harder activity. So you would probably want to start without the stroller would be my suggestion, and then try to transition to the stroller. So hopefully those were helpful suggestions. That paper is available online, free to all. If you do have concerns regarding your abdominal strength, your pelvic floor function, or are you trying to return to an activity level that you're having difficulty with pelvic floor symptoms, then a physical therapy assessment may be beneficial for you. All right. I don't know if we have any questions, but I'm not seeing anything come in right now. Oh, wait. I see a chat. Hold on. Maybe I can do this. Okay. I think I'm okay. So, thank you all for joining or watching at a later date. If you have any questions about return to running and pelvic floor issues postpartum, please do not hesitate to contact me. Thanks again for joining us. Bye-bye.